Okay, so we're going to do a few minutes on benfotiamine. It seems that some of you are searching out there for it, especially relative to peripheral neuropathy. Dr. Gates was just chatting with me about it earlier today, and he was talking about how it's in a lot of these pain support formulas and the mechanisms of how it contributes to peripheral neuropathy. I'm Dr. Mark Rutherford. I'm a certified functional medicine practitioner, also a chiropractor. Dr. Gates.
I'm a chiropractor and a board-certified chiropractic neurologist.
And together we treat chronic pain. We have a chronic pain practice that kind of evolved out of nowhere, more or less, and we've combined our two disciplines of treating the brain nervous system functionally with specific types of exercise and nutrients and herbs and botanicals, along with functional medicine, which kind of treats the rest of the body that way. And we seem to have hit upon a few things that are being very helpful to chronic pain patients and autoimmune patients. And as a result, we have inadvertently developed a large peripheral neuropathy practice. So we're sharing with you the things that we have found relative to peripheral neuropathy, both in clinical practice and in Dr. Gates's never-ending diligent research. So benfotiamine, B1.
B1, yes.
B1.
And B1 is classically known as thiamine, but then benfotiamine or benfotiamine, I struggle too, because I'm always wanting to call it thiamine rather than benfotiamine. Exactly. Is a fat-soluble form of thiamine that is now being used in the neuropathy literature to help control pain, as you discussed. And probably a lot of people out there are wondering, okay, what are these two guys talking about peripheral neuropathy? I've been told that nothing can be done for my peripheral neuropathy. The entire first chapter of the book that we're collaborating on relative to, it's called Peripheral Neuropathy Success Stories, is about exactly that mechanism. And basically, few people have an idea of the amount of education that goes into a chiropractic discipline, because many chiropractors just get out and they adjust necks and backs, which is cool. But what Dr. Rutherford has done in his pursuit of functional medicine, which is looking at how can we correct metabolic problems like diabetes without medications, and using certain types of dietary regimes or certain types of supplementation protocols that are showing to be extremely effective in our clinical practice. And then what I got into in this field of functional neurology or chiropractic neurology, which basically tells us saying, well, can we stimulate a part of the brain that's damaged or a peripheral nerve that's damaged back into life? And we have coupled our two disciplines such that now we're helping peripheral neuropathy patients from all over the country. We even have...
The answer is yes.
I didn't even tell you about this, but the patient who had the patient fly in from Arizona, she's looking at having two people fly from Italy, but peripheral neuropathy, to come and be evaluated.
Because you're continually told nothing can be done for you.
Yes.
And you're also continually told that if you take this vitamin, maybe that'll help you.
Exactly. Oh boy, so that gets into a complicated subject. We're going to do our next...
He doesn't like it when I get controversial. Well, I don't know that that's really controversial.
It's just that that's a longer subject. We're going to do a whole other 5 to 10 minutes on neuropathy support formulas.
Let's keep it going.
But keep in mind that benfotiamine, in and of itself, has been shown to decrease what are termed advanced glycation end products. They're referred to as AGEs in the literature. What that means to you: half of you with neuropathy out there have diabetes. Another certain percentage of you, maybe 10%, have prediabetes as a cause of your small fiber neuropathy. And blood sugar elevations cause damage to 3 tissues in the body: the retina, the kidney, and peripheral nerves. The reason why is that there's not an enzyme in those tissues of the body to get sugar out of them. So if sugar goes into them because of your blood sugar elevations associated with diabetes or prediabetes, then you attract water into those tissues. Hence why diabetics get eye problems, they get kidney problems, and they get nerve problems. What benfotiamine is being shown to do is it's showing to get rid of the sugar from the nerves. It's also being shown to get rid of sugar from the kidneys as well as possibly the retina. The literature regarding benfotiamine is also suggesting that the higher dose you take, the better outcome a person will get relative to getting rid of these sugar molecules out of their nerves and feeling better. Now, I'm not going to give you the exact amounts because I'm not treating you.
Right.
But just know
because updosing means different things for different people. So if he doesn't want to mention something, have you go take it.
Yeah, and then have an adverse reaction, because you need to be watched if you're going to be doing this.
It needs to be updated, updosed according to your case for your specific.
And here's our opinion relative to benfotiamine. If it's effective in the literature studies relative to just taking benfotiamine and improving pain in diabetics, what you need to consider is that if you can control your blood sugar far better than what is currently being done, let's say most of our diabetic patients come in with a fasting glucose of around 150 and A1C around 7 to 7.8, that's considered pretty good control. If you can get your blood sugar down into the pre-diabetic range, and then couple that with benfotiamine, and then couple that with other procedures to rehabilitate your nerves if they're responsive, that is our clinical reality. That's where we
pre-diabetic being like 100 to 126.
Yeah, and A1C below 6.
And A1C below 6
is where we're shooting. So that is where we're operating, and we're using benfotiamine in those types of clinical situations.
And then the same people who are looking for this may be the same people who are looking for like alpha lipoic acid.
Which we're going to talk about next, yeah.
Okay.
Yep.
See, we think alike. So go.
So that's what we have to say on benfotiamine. Know that there is literature supporting its use relative to peripheral neuropathy patients. In chapter 2 of our book, it's mentioned that inevitably every neuropathy case that walks into our office is taking B vitamins because they're hoping their neuropathy is a B vitamin deficient
peripheral neuropathy.
Yeah, exactly. And just know that 8% of peripheral neuropathies are due to deficiencies. That's the high estimate.
8%?
Up to 8% may be due to deficiencies of all the B vitamins. But
I think it's less.
I would agree. But with that
Fair
being
enough.
said, most patients walk in taking B vitamins. And if the benfotiamine you feel is helping you, or if you're going to try it, that's great. Let us know how it works. But just know that there are more complicated issues, and you can watch all of our neuropathy snippets on YouTube. We have a bunch now. And we talk extensively about B vitamins and some of the other ones, and how, yes, you can take B vitamins, but then you have to ask the question, why are you deficient in B vitamins?
Right. So if you're taking benfotiamine, what you're saying is taking benfotiamine helps you a little bit. Just know that there are other issues that are creating the need and that situation.
Yeah, unless you're a
our goal
paleo,
is just to get rid of that.
yeah, unless you're a paleo vegetarian, there's probably not much reason why you should have to take B vitamins.
Which we are.
Which we both are.
And which we don't necessarily tell our patients that they have to be. For those of you who might be familiar with what that means, what that type of a diet may entail. Okay.
And if you have any more questions, you can go to powerhealthtalk.com. You can go to our Facebook page, send us comments there. It's Power Health on Facebook, and then you can also watch more of our YouTube videos on neuropathy. And then we also are going to have www.peripheralneuropathygroup.com. A new website that we're going to launch.
In all of our spare time.
Exactly.
Okay.
Well, thank you for watching, and we'll see you soon.
See you next time.